Welcome to our comprehensive guide on healing after periodontal therapy. In this video, we'll explore the core mechanisms that drive tissue recovery, including regeneration, repair, and attachment. Understanding these processes is essential for anyone interested in dental health or professional periodontal care. We'll break down the cellular sources involved, the competitive pathways that determine healing outcomes, and the key principles that guide successful regeneration. By the end, you'll have a clear grasp of how periodontal tissues recover and what factors influence their restoration. Healing after periodontal therapy centers on three primary aspects: regeneration, repair, and attachment. Regeneration refers to the complete restoration of lost tissue architecture and function, including the formation of new periodontal ligament, alveolar bone, and cementum. Repair, on the other hand, is the healing of tissues without fully restoring their original structure. Attachment mechanisms involve the reunion of connective tissue with the root surface, either through new attachment or reattachment. These distinctions are crucial for understanding the goals and outcomes of periodontal treatment. Regeneration is the biologic process by which the architecture and function of lost periodontal tissues are completely restored. This involves the formation of new periodontal ligament, alveolar bone, and cementum. The goal is to return the affected area to its original state, both structurally and functionally. Regeneration is considered the gold standard in periodontal healing, as it provides the most comprehensive recovery and ensures the long-term stability of the tooth and surrounding tissues. Repair is the healing of periodontal tissues without completely restoring the lost original architecture. While repair can close wounds and restore some function, it does not recreate the exact structure that was lost. This means that the tissue may look and feel healthy, but it lacks the full integrity and strength of the original periodontal ligament, bone, or cementum. Repair is often seen as a secondary outcome when regeneration is not possible. Attachment mechanisms are vital in periodontal healing. New attachment refers to the reunion of connective tissue with a root surface that has been pathologically exposed, such as after disease or trauma. Reattachment, meanwhile, is the reunion of connective tissue and a root surface that have been separated by incision or injury. Both processes are important for restoring the connection between the tooth and its supporting tissues, but only new attachment contributes to true regeneration. During the healing stages of periodontal pockets, four main cellular sources invade the area: oral epithelium, gingival connective tissue, bone, and periodontal ligament, PDL. Each cell type plays a distinct role in the healing process, and their sequence of arrival and proliferation determines the final clinical and histologic outcome. Understanding these cellular sources is essential for predicting and guiding successful periodontal therapy. The oral epithelium is often the first cell type to proliferate along the tooth surface during healing. When it dominates, the result is the formation of a long junctional epithelium. This outcome does not represent true regeneration, as the attachment is primarily epithelial and lacks the structural integrity of connective tissue or bone. The epithelium acts as a barrier, protecting the underlying tissues but not restoring their original architecture. Gingival connective tissue can also invade the healing site. When its fibers grow parallel to the tooth surface, bone remodeling occurs, but there is no attachment to the cementum. This pathway results in partial healing, with some restoration of tissue function but without the full structural integration needed for long-term stability. The outcome is often less desirable compared to regeneration by the periodontal ligament. Bone cells play a significant role in healing, but their early arrival can lead to root resorption and ankylosis. This means the normal periodontal ligament space is lost, and the tooth becomes fused to the bone. While this outcome may stabilize the tooth, it eliminates the flexibility and shock absorption provided by the periodontal ligament, making the tooth more susceptible to damage from biting forces. The periodontal ligament, PDL, is the ideal cellular source for healing. When PDL cells proliferate coronally, they lead to the formation of new cementum and PDL, resulting in true regeneration and structural restoration. This pathway ensures the continuity between alveolar bone and cementum, providing the necessary support and flexibility for healthy tooth function. PDL cells contain progenitor cells capable of synthesizing and remodeling all three supporting connective tissues. Melcher's principle states that regeneration of the periodontal ligament is the absolute key to new attachment. The PDL provides continuity between alveolar bone and cementum and contains progenitor cells capable of synthesizing and remodeling all three supporting connective tissues. This principle guides modern periodontal therapy, emphasizing the importance of targeting PDL regeneration for optimal healing outcomes. The outcome of periodontal healing depends on which cell type arrives first and dominates the healing site. If epithelium proliferates first, a long junctional epithelium forms, resulting in a barrier, rather than true regeneration. If gingival connective tissue dominates, fibers grow parallel to the tooth, with no cementum attachment. Early bone cell arrival leads to root resorption and ankylosis. Only PDL cell proliferation results in true regeneration and structural restoration. Periodontal development is initiated by cells at the site of tooth formation. The process involves disruption of the epithelial root sheath, followed by cell-cell and cell matrix interactions, growth factors, and cytokines. This leads to reorganization of cells between the tooth and bone, migration, attachment, orientation, and proliferation factors. Progenitor cells then differentiate into periodontal ligament, bone, and cementum, establishing the supporting structures for the tooth. Periodontal regeneration is initiated by inflammatory factors such as cytokines and growth factors, or by marrow-derived cells. Granulation tissue forms, followed by migration, attachment, orientation, and proliferation factors. Progenitor cells then differentiate into periodontal ligament, bone, and cementum, mirroring the developmental pathway but triggered by healing rather than development. This process is essential for restoring lost tissue architecture after periodontal disease or injury. In summary, healing after periodontal therapy involves complex cellular and molecular mechanisms. Regeneration is the ideal outcome, restoring lost tissue architecture and function. Repair and attachment mechanisms provide partial recovery but lack full structural integration. The sequence and dominance of cellular sources determine the final outcome, with periodontal ligament regeneration being the key to successful healing. Understanding these principles helps clinicians guide therapy and optimize patient outcomes.